Joining me today on the show is Dr. Angus Ritchie and Dr. Andrew Wilson, both from Sydney Local Health District. Hey, gents, how you going?
Great. Nice to be here, Pete.
Good to have you on the show. I'm keen to dive into a little bit more to understand about Sydney LHD. I'm a Sydney boy myself, and obviously the Sydney Local Health District is significant in the area. So I'm keen to understand how healthcare's done in this part of the world and the role that technology plays. But firstly, let's set the scene. I might get you both to tell me a little bit more about what you do and your role. Let's start with Angus.
Hi, thank you. Yeah, so I'm the Chief Medical Information Officer for Sydney Local Health District. I've been doing that for about 8 years now. I'm also the Clinical Director for Digital Health and a nephrologist practicing clinical practice at Concord Repatriation General Hospital.
Appreciate it. Thank you. And what about yourself, Andrew?
So, Pete, I'm a psychiatry registrar, and I work within Sydney Local Health District at the Royal Prince Alfred Hospital. Unlike most kind of psychiatry registrars, I actually work in the main hospital, so I deal with patients with medical illnesses that may have some psychiatric stuff going on at the same time. I'm also pretty heavily involved in the after-hours service at RPA, which is a very busy hospital within our network. I probably cover, say, 30 to 40% of the hospitals on call every week. So I guess both of these roles kind of require me to, see a lot of patients across the day and provide some detailed documentation and assessments. That's kind of how I became interested and involved in the digital health space.
Yeah, love it. Look, it's great that we've got both the, the strategic perspective as well as then very much the front line on the day-to-day to understand. I'm keen to understand a little bit more about the problems to be solved or the challenges that Sydney Local Health District faces, because, we say often on the show, we can create all the fanciest and flashy technology, but it's not actually solving a problem, or if it misses the mark, then it's kind of a moot point. So really keen to understand, Angus, from your perspective, what are some of the challenges that you face within Sydney Local Health District?
Yeah, look, I might set the scene a little bit. So Sydney Local Health District, as you say, it's based in central Sydney. We have 7 hospitals and 1 virtual hospital, and we serve a population of about 750,000 with another 1 million or so people that come into the health service every day to work or to study. And we have to meet all those people's needs, and they're quite a diverse community as well. And like most health systems, we're struggling in terms of rising demand for our services, constraints on the ability to add new staff, either because they're not available or they have trouble, getting into the positions. And so we're looking for anything that we can do to reduce the pressure on our staff, to reduce the risks of burnout, the amount of overtime they have to work, and to try and help them improve their experience of delivering care, whilst also improving the experience for the patient or the consumer who's on the other side of the table.
Yeah, look, I'm hearing from you the challenges that are being faced across the world. I was going to say across Australia, but across the world too in healthcare right now, trying to do a bit more with less. We've got increased patient expectations and requirements of the healthcare system too, and this burnout issue is a really important one too. Love to unpack a little bit more about some of the initiatives or the ways that Sydney Local Health District are kind of addressing these issues in the current climate.
Well, a big focus, I think, is around digital technology and how we can use that to reduce the pressure on staff whilst allowing the quality of care and the documentation of that care to be increased. So one of those areas is around how we do clinical documentation. Obviously, there's a strong desire that we document everything that we do, and I think also increasingly provide better access to that information to the patients and their carers, because as we've learned through the COVID pandemic, when you're looking after someone, that traditional model of coming in for a consultation and then going home and somehow remembering what you need to do from that discussion and then following up before you come back in 3 months' time, that model doesn't work anymore. It's much more of a conversation. People want to take away some information, but then have some extra information sent to them afterwards. They want to be able to communicate with their providers. And all of this adds more pressure to the system to provide the same sort of level of care for that person. So anything we can do to make it easier to get that documentation down and to make it clean, easy to digest, and available for different audiences, both the medical audience and the patient, are things that we're very interested in.
Absolutely. I mean, that's the heart of everything in healthcare, I guess, if is one perspective, because so much communication that needs to be done and interpretation within healthcare generally, and that's based on information that we've got, which is sometimes abstracted or received from patients and then kind of digested, and then the clinician does something with it. So the taking notes along the way is difficult to do. It's a busy kind of environment that I imagine that contributes to the burnout factor too. So these technologies that help with the documentation side of things, tell me more about the types of tools that you're using specifically in this improving the documentation side of things.
So the main tool we've been playing around with the last couple of years has been Dragon Medical One. We took to this during the COVID pandemic to try and improve the efficiency of documentation in clinical care. And so we partnered with Nuance, now Microsoft, and implemented their cloud-based speech recognition. It's probably about 2020 or 2021. And then we've tried to expand it from that point as we found where we've got the most benefits and tried to test new use cases. But the most valuable area we found is in the outpatient areas, where you can have that consultation with the patient. You can quickly get down your letter or your notes using Dragon Medical One, and then you can turn that around and make sure that it gets out to the either referring doctor or copies to the patient and other clinicians as quickly as possible. And we found that's a really high value area because it replaces transcription services, which can have a turnaround time of between 5 and 7 working days before we get a copy of that draft back, and make sure that we get it out the door often on the same day as we see the patient. I think the other advantage is that over typing it yourself, I mean, if you're a good typist, you might be able to get out 35 words a minute. There's a lot of our older clinicians who've more the two-finger typist style, and they can really adapt quite quickly to getting things out with their voice in way over 100 words a minute, so it's much more efficient for them. And you can see it appearing on the screen in front of you, which is a nice little feature.
Yeah, and that's interesting too, because I imagine people probably might have played with speech recognition technology in the past too, and we've got Siri on our phone, and we've all kind of experienced even the IVR when you call up a contact center and it says, "Tell me the thing that you want," and then it kind of understands half of what you've said. You know, we have touched on this from time to time on the podcast too, but that the technology has evolved quite significantly to a point now where it's reliable. Is that right?
Yeah, much more reliable. Minimal training required. People can pick it up and get started as soon as they've got an account. And you're certainly right about the culture of using your voice to create text. 5 years ago, you didn't really see the consultants walking around dictating messages on their phones, but you certainly do now. You see them walking from meeting to meeting, using that moment to communicate, and often taking a much longer form, sort of short abbreviated messages they would before. You really get much more of that narrative now as part of that adoption of voice to text.
Yeah, and I guess that's one thing that it improves. Like, you can make use of that time in between consultations, or not hang around longer to write up notes that may not be of very good quality anyway, especially if it's after the fact. But you know, the reason why we're here is to improve patient care. Like, how do we kind of connect the benefit or the convenience for a clinician of not having to hopefully having a more pleasant experience in that little part of the bigger workflow, to actually like a return on investment in the way of better patient care or whatever else the justification might be?
I think the main benefits in the current generation technology are to reduce the burden of documentation for providers, to reduce what the Americans call pajama time. We don't really think of it in that way, but that time you spend outside of hours in the evenings completing your documentation and taking it home, or having to work on it later. And also the other main benefit is that turnaround time. So from the time you have that consultation to the time that lands in the inbox of the referring doctor, or a copy goes out to the patient can be as little as a few hours to a few days. And that has a huge impact, I think, on really embedding that education that you provided and the patient really adopting those instructions and changes to their management and making sure the whole team is aware and can work on that quickly. I think that's a huge benefit.
No, I agree. Hey, Andrew, you've as I understand, you've utilized some of these tools in your practice, and at some point, you like in using any new technology, you've got to start. You've got to go from the old way you did it to the new way. What was that process like for you in terms of picking up this new tool and having a crack?
Yeah, so Pete, my previous supervisor at Concord Hospital, actually, I walked in one day into her office and she was dictating. And I asked her, look, what's this software? And she was actually using Dragon as one of the first onboarded clinicians. Now, I had actually used and recognized the value of dictation, but with a dictaphone as a role as an orthopedic registrar in Queensland, dictating outpatient letters. So I was already well aware of kind of the benefits of some modes of dictation. But really, when I moved to Sydney Local Health District last year and began using Dragon from October, is really where I saw the shift in productivity in not only my outpatient, but also my day-to-day kind of clinical load. I had some training through Sydney Local Health District, and that made the onboarding process a lot easier. And it was actually formalised. So I'm actually quite grateful to SLHD for having that in place. If
we were to, I guess, compare the way you did it before to now and then try and tie it to the outcomes of that, how have you seen how do you describe the benefits of utilising a tool like the speech-to-text style to then tying it to things like benefiting patients or anything else?
Yeah, sure. Look, so before I was hand typing everything, and as Angus kind of alluded to beforehand, you're typing at roughly 35 words per minute. So, for example, in June of this year alone, I actually dictated over about 120,000 words. That took me 16 hours. Now, if I was to have hand typed that at 35 words per minute, that would be taking me 60 hours. What that allows me to do is be quicker with my documentation, more contemporaneous with my documentation. And how that affects, the clinical environment is when I'm working in the emergency department doing on-call, people can see my notes in a narrative form, in an expanded form, more quickly, more dynamically than they would if I was going back to my desk and spending an hour typing them out and finalising and revising my notes. So it benefits me from a time management perspective. It benefits from the patient from a contemporaneous documentation perspective, but it also actually affects the dynamics between mental health clinicians and the rest of the system. And that might include other teams in the hospital in my role as a consultation liaison psychiatry registrar. It might also just include family members. It might include nursing staff. It might include the bed manager. There's a knock-on effect that is actually really significant with contemporaneous, accurate documentation.
Hey, I'm thinking as you're saying that too, that's great that we can capture a lot more information in a patient's record. And I'm interested in your thoughts too, because you'd be the one to kind of, you're taking notes so that, as one of the reasons you're taking notes is that another clinician might be able to pick up and continue to see a patient. If I was to pick up a file and then see like a mini thesis in a patient record with everyone's kind of random thoughts that they had as things went along, it's kind of like, well, what am I supposed to do with this information? And it comes to this challenge that we face in healthcare now. Is there's so much data that's out there. It's like, well, what do you do with it? So is it beneficial though, in terms of giving everyone the ability to have their own mini podcast and have a big ramble into a patient file? Are we just creating another problem though, Andrew? But you've seen it firsthand, so tell me about.
Yeah, look, Pete, at the start of the learning curve where things are a little bit steeper, I think it's very important to be cognizant of the fact that speech is more voluminous, say, than hand typing. You can get more down. Does that mean you necessarily need to get more down? No. So it's about learning the skill of voice recognition, which is in itself a skill, and moderating what you're putting down on paper so that you're not just providing your own mini podcast, you're providing relevant information, and you're not actually slowing yourself down by dictating more, but you're keeping pace with actually your clinical load.
And there's another aspect to that too, Andrew, and I think that as we've reduced and focused on data quality issues, and we reduce the volume of data in some areas and capture more discrete data perhaps, what we've often lost is the narrative of what's happening, the patient's story, and that difference perhaps between their own version of that story and the different perspectives of the different team members that come to look after them. And I think that's particularly true in psychiatry, where what the patient thinks about their illness and their own healthcare is often very different from the healthcare system. And it's important to capture both, not just that one person's perspective. And the voice to text helps you to do that. And so there's less of the, just copy and paste the problem list from one note to the next. And actually, what did they say today? And I've put to them our management plan. What is their thoughts about that? And can I get that down in the notes as part of the record? And as we move towards more open notes, towards more access of the patients to their own records, I think that sort of consideration becomes much more important, because sometimes you don't get to reconcile those two perspectives. They may not come together. And so it's important to document them both as part of your decision making.
That's such a good point. And, we've definitely evolved to an expectation, whether it's active now or whether it's in the pipeline of this open notes concept, or that gone are the days of notes being taken in a clinical file being only ever seen by the clinicians. There's expectations for patients to be able to access information, and potentially that's just not out of a rights thing. It potentially has the ability to allow patients to take more of their health in their own hands. So it's only good things. But for that to happen, the type of data that gets taken probably needs to evolve too, to be more meaningful. So that's a really interesting point. I like that. But any technology, any new technology within a healthcare setting, Angus, needs investment and requires some planning. So a lot of people do look to Sydney LHD, either in New South Wales or other parts, in terms of implementing solutions. So and we've got a good amount of the Australian public health system that check out the pod too. In terms of your reflections or key bits of advice or recommendations for healthcare settings looking to implement technology, specifically speech recognition, like if you've got any thoughts or lessons you've taken from your past one that you could share with others.
Yeah, look, I think the current technology, which is really about voice to text and not as much formatting, and I do want to come to what the future sort of stages of technology will look like, because it's quite different. But with the current technology, you need to look for areas in your business where people have to do a lot of clinical documentation, and they need to do it quickly, because either it's important that it be done, as quickly as possible, or it's such a large volume, it's taking up a lot of time and eating into staff productivity. And where that may use a transcription service, that has a real cost associated with it, and you can focus down on the return on investment. And so I think you need to look in your business at those two areas. Where do you get good return on investment because you've got a cost that you can reduce, transcription services, or where do you have the biggest productivity benefit? So the two examples that we used were the productivity benefit, I think, has really come in mental health. That's been a really good area for us to look at, because those staff do a lot of clinical documentation. They have to write a lot of letters. They have to do a lot of very detailed mental state exams, documenting all of the patients presenting problems. And it's often not an easily copied and paste problem list from a previous encounter. It really needs to be captured each time. So that's been the productivity area. And then the outpatient correspondence has been a good area because it allows us to replace transcription services at a lower cost. And if we've worked out, if you're doing 10 letters a month of 20 lines, then you're going to do better using speech recognition than if we use the transcription services. And most of our clinicians who run a clinic once a week will be doing a lot more letters than that. And so those are the two areas I would suggest that people look to in their business. The other areas like medical imaging, reporting, and anatomical pathology, so pathology reports of biopsies and other specimens, they're also very productive areas, but they've also been using speech recognition for a long time and are already much more consistent, high volume users. I think there's that untapped potential of those other providers, and one of the ones that we haven't really delved into yet, but I'm really keen to, is looking at nursing documentation, because there's a lot of nurses who do very complicated documentation, as well as allied health providers, say in a wound clinic or in a high-risk foot service, where they need to do a lot of documentation. They're often typing it out, and many of them don't have access to the transcription services. So there's a real productivity benefit, I think, if we look at those groups.
No, I really like that. That makes sense to me in terms of being able to, because sometimes you just got to justify the hard costs and the benefit, and so that transcription service thing makes sense, and that'll be a part of it. But then the productivity gains will be obviously, I think so. The ability to demonstrate a more even more meaningful impact, and in the mental health side, where we've got the longer consultations, increasing demand generally on the system. That seems like a good step case. And keen to dive into the future in a second too. So we'll come back to you, Angus, on some of those other points. But Andrew as well, I'm given that you've used a lot of the tools firsthand, and there'll be others that will come through and need to start using them. Any advice that you can give to those that might be starting to use some speech recognition tools, which might change how they do things and may not necessarily be comfortable straight away?
Yeah, look, I think it's important to consider the learning curve. It's a curve, and it actually changes in its gradient. So it's always going to be a little bit more challenging to start off with, but it will flatten out. At least from my experience, it has. There are kind of onboarding, there's plenty of onboarding support to assist you kind of through your, initial journey into uptaking this technology. As doctors, we have to read a lot of research. We have to stay agile within our field. We have to participate in continuous medical education. We learn, we read research papers. I approach technology and health in kind of a similar vein, with a similar approach, in that this is another part of your clinical practice that could be a source of growth. It could be a source of evolution. And so keeping an open mind with regards to technology and health, I think, is just really important. And it's a way of staying current and being able to find, the optimal care for your patient as we continue to develop models of improved care.
Just picturing those clinicians that just caught up from going from handwritten notes to typing notes. It's like, now I got to do the verbal notes. But sounds like the tool that is complementary to all of those needs, and once kind of not even mastered, but kind of more comfortable with it, can have those material step changes in terms of productivity, like you say, the 35 words to something much more. So that's super cool. Look, future thinking, Angus. What can we look forward to seeing from Sydney Local Health District, or where are your kind of priorities at in the coming months and years?
I think there's some really exciting stuff that's coming down the line. So you talked before about voice and the power of voice, and the voice is not just about saying what you want to be written in the notes, which is what we do currently. Voice is about capturing the sort of nuance and intent of the conversation, perhaps taking quotes from the patient or their carer that really fill out or take away that sort of my own interpretation and make sure that the other voices are apparent there too. And then also, what can you do to your voice to control actions in the system, to automate and take away from administrative tasks or extra steps that you'd otherwise have to click to do. We know that a lot of the benefits in terms of adoption and user experience of systems, they're not related to getting data into the system. They're related to getting data out of the system. What can you get out? And that's what I think a lot of these systems are going to bring us. So the kind of directions, I think it's generally called advanced clinical documentation systems. So can we listen to that whole conversation I have with a patient? Can I just maintain eye contact with them the whole time? just focus on listening to them? Can I allow something else, some system, to listen to that conversation, to transcribe it in real time, and then to create my documentation for me, and then to recreate versions of that documentation for the different audiences? I might want a progress note that's got all the detail. Then I might want to summarize that into a letter that I send back to the referring general practitioner. And maybe there's a sort of education summary that a patient could take home so they can remember those key points straight away from that consultation. Some of these systems can provide those capabilities. And then even further beyond that, they might start to listen to the emotion in the conversation and capture not just the text, but also what's sitting behind it. And you can imagine very easily that artificial intelligence will really be able to track those patterns and hear things that we don't hear in clinical practice, or that we get distracted and miss. And then that last step of really automating what we have to do with our fingers and our mice, our keyboards at the moment, and say, okay, I heard what you've said. I know what you want to do. Let me prepare that for you. Or maybe let me take away those steps and I'll just get ready the list of orders that you need to sign, or the script that you need to generate, or the instruction you're going to send off to someone to change the dialysis parameters for today. I think that's where it's really exciting, where we're going to see huge productivity benefits and translate all that investment in artificial intelligence, in large language models, and really bring that to bear, translate it into clinical practice to improve the experience that we give to our patients and for all the providers that deliver those services. So I find that really exciting.
Done a really good job in articulating like some of the real practical benefits there of some of these tools. Sometimes we get a little bit too excited and gung-ho, and it's because there's a lot of cool things that can happen with artificial intelligence, and healthcare needs cool things to happen to it. But beyond the surface level, being able to talk about how some of these, let's get the foundation right, and then really start to tap into the potential of these tools to do things that other tech hasn't been able to do in the past. Like you say, the understanding emotion, getting to the real crux of issues to address these kind of key points and challenges that you outlined clearly at the start of the conversation. So I'm keen to watch with a lot of interest. Angus, Andrew, I appreciate you making the time to come and have a chat. We'll put the details for Sydney LHD and some of the other stuff that's been happening there in the show notes of this episode. Thank you so much for joining.
Thank you.
Pete.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.